Hey everybody, it's Dr. Ashley, pediatric emergency mom, coming to you live on this very cold in Louisiana. What day is it? Thursday. And so today I'm having a conversation with Jenn Herricks from Louisiana Families for Vaccines. And we had it's my fault. I messed up the time. So she'll be joining me hopefully shortly. But I wanted to give a little bit of a background on how this conversation even came to be. So there was an article published by NPR at the end of December, I think December 20th. And the title of the article said, LDH workers, Louisiana Department of Health workers, forbidden from talking about flu vaccine, something like that. And the article was pretty shocking, honestly. It went into quite a bit of detail about, oh, wait, here she is. One second. I'm just going to add Jenn. Hi, Jenn.
Hi, can you hear me okay?
I can hear you great. I am so sorry. I started it and I was apologizing to people because I messed up the times.
No worries.
But welcome. I was just giving a little bit of a background on how this conversation even came to be. Basically, the NPR article kind of kicking everything into motion about LDH workers coming forward anonymously, fearful of their jobs, that they are not allowed to talk about flu vaccines, and there's no promotion of vaccine events, or there's no vaccine events.
Right.
And even on social media pages for LDH, like I think it still has the 2023 flu information. There's nothing updated. So this is Jenn Herricks, everyone, from Louisiana Families for Vaccines. So Jenn, if you wouldn't mind just telling us a little bit about your organization.
Yeah, thank you so much. So I'll just give a little bit of background about myself and how the organization started and kind of where we are today. So my training is in microbiology. And then I also did some postdoctoral work in public health policy, global health policy. And really, I was working in Texas at the time. And I think very naively, as a scientist, thinking that I could help to translate some of this very complex scientific issues for our lawmakers so that they could help to make better decisions for their constituents. And I walked into the Texas State House when Texans for Vaccine Choice formed, and they are, at the time at least, were the largest anti-vaccine PAC in the country.
Wow.
And they formed as a response to California getting rid of their non-medical exemptions for school-required vaccines, which California did because, I don't know if anybody remembers, in 2014, they had a huge measles outbreak that spread to 7 states, to Canada and Mexico. So it was a really big deal at the time. And so since then, California immunization rates have definitely risen, but we definitely saw a backlash in other states. And so I, realized at the time, like, wow, this is a lot more complicated, and it's not just about what the facts are. And it's really important for everyday people, even, you don't have to be an expert. You can be a parent, a grandparent, a teacher. It's really important for you to talk to your lawmakers about these types of policies and why they matter. And so fast forward a few years, my family and I had moved home to Louisiana, where we're from. And it was the summer of 2020, and we started noticing that the legislature was considering some pretty scary public health bills in the middle of a pandemic when we didn't even have a vaccine yet. And so started noticing that there really wasn't a lot of that pro-vaccine voice present at the Capitol and in the room with our lawmakers. And so really wanted to make a place for that to happen. And was very fortunate to be able to start this group, Louisiana Families for Vaccines, which is kind of our grassroots home for vaccine advocacy in the state. And we welcome anybody to come and join us. in 2022, that was like the first year that we formed, and we saw 39 anti-vaccine bills in the Louisiana legislature, but we were able to stop all of them. So 38 stopped in the legislature itself. One got to the governor's desk, but was vetoed. So now, fast forward a couple of years later, we have a very different administration. And unfortunately, we see now these policies that aren't even taking place at the legislative level, but they seem more unofficial policy changes happening in the Department of Health, as you said, where now, they cannot talk about, promote, even educate about the benefits of the flu vaccine. And so that's kind of where we are now, but I'll let you ask some more questions. And
yeah, so I think it's interesting how, we both live in Baton Rouge. We're both very involved in healthcare and in advocacy. And I didn't even know that this was happening when this article came out. A friend sent it to me and I was just blindsided. We talked yesterday, and so this kind of ties in. We talked yesterday about the sheer number of the bills and legislation that comes about, and if people don't know, like, really anyone can submit a bill or a thought or something to their local lawmaker, whoever's representing their area, and say, hey, I think you should consider this. And if that person says, oh no, I agree, this is a good idea, then it can be presented and moved forward, essentially.
Mm-hmm.
And so to keep track of the sheer number of bills in session, and the number that are healthcare related and then vaccine related, it's like, how, as a someone who's not going to the Capitol often, right? You go to the Capitol quite often during session. Like, how do you keep up with all of those?
Yeah, so it's a lot. Luckily, we have a software that helps us to find those bills when they come up and track them. And so that's helpful. And we are really, for anyone who's interested in legislation that is specific towards vaccines, our website, we will post updates on what the bills are that are being introduced, when they're getting hearings. And for anyone who doesn't know, every time a bill gets a hearing, you can email the entire committee. You can call the entire committee. You can show up to that committee meeting if you have the time, which, depending on where you are and where you work, it's always during the week. But you can show up, and everyone in the state has a right to tell our lawmakers what they think about this bill. And it can be as simple as, I just want you to know that I don't support this bill. It doesn't have to be anything complicated, but it is very important for them to hear our voices.
Absolutely. And we'll talk in a bit about the resources you have available on your website. But that's the scary thing too, is that a lot of these bills come from non-medical people, some from medical people, but lacking in some of the solid science. And that if we're not there to advocate for science, then some of these get passed through. You mentioned 2022 and being fortunate enough to have like none of those pass through. But even in the NPR article, it says since this new administration has been in office, our new governor, this is from the article, and I'm hoping you can comment a little bit toward it. I'm reading my notes. There have been 5 bills that have been passed and 2 resolutions aimed at loosening vaccine requirements.
Yeah. So last session, which really was the first session that we had with this new administration, there were a lot more. Like previously, we were able to stop most, if not all, of the anti-vaccine related bills. Unfortunately, this session, we did see some pass. And so, and a lot of these bills are bills that they file year after year. And, just because they don't pass one year, you can expect pretty much to see it come back again, sometimes in a slightly different form. And so one example of that is they have been trying for a few years now to get vaccine requirements conflated with discrimination. And so that had some success in our legislature this past session, where a bill passed that said schools couldn't discriminate against students based on their vaccine status. Now, the only thing that schools really do relative to vaccine status is ask for parents to submit either their child's immunization records or an exemption form, right? And so that they can have those things on file. And the reason that those things are so important to have on file is because if there is an outbreak, let's say the school has a low immunization rate for measles, which for measles, if you get below 95% in your vaccination rate, then you're at risk for a measles outbreak because the disease is so contagious. So if you do have a measles outbreak in a school, you want to be able to know which students are vaccinated and which are not, because you want to know who's vulnerable. And those who are not vaccinated, it doesn't include just those with personal belief exemptions, but also includes those with true medical exemptions who cannot be vaccinated. So it's very important that we are able to protect those students. And, what public health would do is say, the school would say, okay, for those students who are not immunized, since we are having an outbreak, we need you to stay home for X amount of time until we can say for sure that this outbreak is over. And a lot of times, it varies depending on the disease, but that's going to be a number of weeks past, when the last case pops up to make sure that there are no further ongoing cases. And currently, even with the status of that bill, that part of our law still overrides that. Apparently, that's what the legislature said, because that was a concern that was brought up, that this new law would prevent that from even happening. But we have heard people from our local anti-vaccine groups saying they would like to reverse that if an outbreak happens, they don't think a school should be able to prevent unvaccinated students from attending during an outbreak, which would only serve to put those students in harm's way and the rest of the community, because it would just promote that outbreak spreading more. So that's
Right.
just one example of what's happened this past session.
It's a lot.
Yeah.
It's a lot to take in. What are your thoughts on, we're seeing more and more from government leaders, this anti-vax sentiment and rhetoric. And it's very, and I want to be clear, I think Jenn and I are both very much in agreement that, science is science. Mm-hmm. And the data is there. I mean, it's really all there, right? The research has been done, the data is all there. And so to have people in positions of power, the Louisiana Surgeon General, the proposed head of health in the new administration, mm-hmm. who are objectively anti-science mm-hmm. in these positions, is such a slippery slope, and should not be political, right? I mean, right. It's and so how do you see, it's kind of a little bit of probably a loaded question, but how do you see the next 2 years, 4 years going, and what can we do to help propagate science and fight misinformation?
Yeah. So what I think, there are a lot of amazing scientists putting themselves out there and speaking the truth. And it's important, no matter what our background is, if, we are people who vaccinate ourselves and our family, and we understand the value of vaccines. I know a lot of us have people in our family who can't be vaccinated, who are immune compromised. Maybe there's a newborn baby in the family who can't get all of their vaccines yet. All of these are very, very important reasons to support the science. And so it's important to use your voice and to speak up. And so our organization, I think a lot of times people just don't know how to do that. Where do I go? Who do I call? Who do I email to say this? And so we try to provide, like, here's who to call, here's who to contact, here's what's going on, and give a list of talking points so that people can understand the issues and then hopefully find the words and find their voice. And I think that the more of us can do that, the better. And so one example is we do have, and I know you said we're going to talk about this later, so stop me.
No, it's good.
It's good. But
it's later.
So on our website, you mentioned the nominee for Health and Human Services, which is RFK Jr. So for those who don't know, RFK Jr. leads, he leads the nation's largest anti-vaccine group. It's called the Children's Health Defense, which is a very, sounds like a good thing, but it is full of anti-vaccine falsehoods, misinformation. And so we have a really easy form that people can fill out, and it gives you an email with talking points that you can edit if you want, and you can send that to our senators, and you can ask them not to confirm him. So yes, he has been nominated, but he has not yet been confirmed. So the Senate still needs to vote on his confirmation. So you can do that. Physicians can find a sign-on letter that will go to our state senators, Senator Bill Cassidy and Senator John Kennedy, asking them to vote against his confirmation as well. And Senator Cassidy in particular, he is a physician. I think he understands the critical importance of vaccines. And so we're asking physicians, to support him in his pro-vaccine stance. He's been very pro-vaccine in the past. And he has already said, he believes that RFK's position on vaccines is wrong. And so we just want to show him that the physicians in the state support him in that stance and support him in making the right move. And in terms of what the Louisiana Department of Health is doing, we have an open letter to them that is open to any healthcare worker in the state. So whether you're a physician, a nurse, a pharmacist, a social worker, if you consider yourself part of the healthcare workforce in the state, please sign on to this, because I know we all see this issue from so many different angles on why vaccines are important. So please add your voice to that letter.
Yeah, no, these are great points. And I mean, I've been to your website, super easy. You just click and it's super easy to do. I think it's interesting too. So I've had this conversation with some people, and they said, well, LDH didn't say to not get the flu vaccine, right? They're just shifting it to primary care, talk to your primary care provider instead of LDH being the one. And the biggest issue I have with this is that in not saying some things, you're speaking volumes, right? So in not saying, hey, it's really important to protect the community by doing your part and getting vaccinated, by not saying that, you're really saying to me that you're, I'm going to say it, anti-vax, right?
Yeah, I mean, they are, our state's public health system. And, part of the job of public health is to educate and inform the public. And, they did do a post recently about the flu, because Louisiana right now is experiencing the highest flu rates in the country, which is huge. So they've done one post on that. And in the post, they list ways to avoid the flu, but notably missing was getting your flu vaccine, which is probably the number one thing that you can do. And, yes, the flu vaccine is not 100% effective. No vaccine is, but it will reduce your chances of getting the flu. And if you do, it will reduce your chances of needing to be hospitalized. It'll reduce the severity and duration of your illness. And that all reduces the chances that you can pass it on to other people who are vulnerable. So getting your flu shot is one of the most important things that you can do. It's extremely safe, even for people with egg allergies. Some people with egg allergies are concerned about the flu shot because it is produced with eggs, but there are also egg-free versions that are available that you can ask for. So, but yes, the Department of Health just completely leaving out anything about the flu vaccine. As you said, it speaks volumes. And another point is that, not everyone has access to a primary care physician, really, unfortunately, especially in a state like Louisiana. And the Department of Health every year has done flu vaccine clinics where people can go in their own local communities and get that flu vaccine. And for a lot of people, that was their access. That was, how they kept on top of that every year, and they have lost that. And so, we will probably have a much lower percentage of people in our state who are able to access the flu vaccine, not because they don't want it, but because they don't know it's available. You don't know to go and ask for something if you don't know it's available.
Right. No, I think it's an excellent point. You see countries that have had such an improvement in their public health and overall health, countries like Costa Rica, where they're bringing medicine to the communities. And so we know that bringing medicine to these at-risk communities or communities that don't have the resources, they don't have a vehicle, they don't have a primary care physician, they're working 3 jobs, so they can't get an appointment during the day to go, it's very limiting for a lot of people. And so, so you're right, that was something that people leaned on that wasn't available this year. And, really getting vaccinated. And we talked about this yesterday, how many people say, well, I've never ever gotten the flu. So, and I've never gotten vaccinated. So I'm just not going to get vaccinated. Well, okay. Like I said, if you've truly never gotten the flu, you should probably buy a lottery ticket because that's pretty darn amazing. But getting the flu vaccine, another thing we hear is well, when I get the flu vaccine, I get sick. And so it's not worth it. Mm-hmm. And the flu vaccine, the shot is not a live vaccine. And so you can't get the flu from the vaccine, right? But what I always tell families is, well, but you probably went into a clinic where maybe there were sick people, or maybe you went to Walmart right before, or, who knows? But that shot is not how you got sick. And so dispelling, sometimes I feel like I'm screaming into the void to say these things over and over again. But you can't get sick from the flu vaccine itself. I think that getting vaccinated, especially for things like the flu, is an incredibly selfless act because you're often doing it, I do it to protect my family. I do it to protect my patients. But when we do this together, we protect each other, mm-hmm. right? And people don't realize, I think, that immunocompromised, it's not just people that have cancer, right? These are people who maybe you don't even know they had an organ transplant at some point and they're still on immunosuppressive therapy, mm-hmm. or maybe they have ulcerative colitis or Crohn's or whatever, and are on immunosuppressive therapy. And so it's protecting those people. It's protecting infants. It's protecting the elderly. It's just, I think it's just the right thing to do.
I 100% agree. And you know what? I think a lot of people realize that too. I think most people understand that they're doing something that's good for them. They're not going to get sick. or if they do, they're not going to get as sick. It's going to be, I'd rather be, if I had to be sick, I'd rather be sick for a couple of days than, out for a whole week with fever and chills and the whole thing. And I think most people understand that it's not just good for them, but they're also doing a good thing for the community, or at least I hope that most people do. And I believe, most people still believe in vaccines and want to get vaccinated and hope that their neighbors are getting vaccinated. They just don't know, I think, that there are these policies that are impacting, access to vaccines for a lot of people. And so, the way that our school and public health system works around vaccines and how that could impact public health. And so really one of our goals is to inform the public and to let people know, hey, this is happening, and to help them to, get their voices heard.
Absolutely. And I think when, obviously we didn't know each other then, but when I was talking quite a bit about the COVID vaccine, when that came out, and there was a lot of fear, confusion, misinformation. If, I think some people, if they're in certain settings on a regular basis and they're hearing the same thing, the same message, and that message is anti-vaccine or incorrect science or incorrect information. I shouldn't say that because it's probably not science. Then they really don't know, and so that's why for me, for you, I know we're here for people. If people have questions or want to know more, we're here and we can answer those questions in a non-biased, objective way. Because for a lot of people, they truly don't know where to go to get that information, right? Because if you're kind of down one rabbit hole and then you do a search for flu vaccine, then your algorithm is going to feed you some not so accurate information.
Yeah.
So I want to get your opinion on this. I tell families when they want to know about whether it be vaccines or common childhood illnesses or whatever, I tell them never Google, right? Don't Google. But I send them to the AAP's parent site, healthychildren.org. Or I tell them, but my easy, quick and dirty is look at any major children's hospital's website. Boston Children's LA, Pittsburgh. I mean, CHOP, Children's of Philadelphia, pick a major hospital, and they have tons of free information available. Do you have any other hot take websites that you recommend?
Yes. One that I really like a lot is Voices for Vaccines. So it's voicesforvaccines.org, and they have tons of resources and information for parents, including, I love they have vaccine sheets for each vaccine that your child needs. And they're made so that you can print them out and bring them to the doctor with you. You can write down the questions that you have. It gives an explanation of why you need the vaccine, what the vaccine is preventing, any possible reactions you might want to look out for. But it gives you that space to have your questions for the physician and write down their answers. So I think that that's a really great resource for parents. And they just have so much on their website. I hope everybody goes and gives it a look and checks it out. And I will say that you mentioned CHOP, and I love that website as well.
It's so good.
It's so good. In particular, they have their vaccine education center. And I think, they have a newsletter that they send out for parents that always has really great topics and really great information. So love those.
I love that. I think that's a great point. Our primary care providers, pediatricians, family medicine, internal medicine, those that are still doing the Lord's work truly, because they're the first line of defense, right? To catch something that may be really off. They're seeing tremendous volumes of patients, and God love them, or oftentimes have a full day, go home with their family for a bit, and then they're still charting at night. And so with respect to their time too, if you have that vaccine sheet, you know what questions you have going in. That's, I think, a lot better, not only for physicians, but for families. They're going to get the information that they need pointedly instead of saying, well, I don't know about vaccine X. Why should I get? But if you're proactive and have that ready to go, I think that's fantastic.
Yeah, I really like it. And I think too, a lot of people sometimes are worried. They're worried about asking questions, or they think, well, if I'm not sure about this vaccine, then maybe I just shouldn't get it. But we always like to tell people, making a decision not to do something, you're still taking a risk. And when it comes to vaccine preventable diseases, the risk of not doing something is much, much higher than getting the vaccine, where the risk is really low. So there's
Right.
always a risk involved. And it's really important to be able to weigh that. And it's totally normal to have those questions. And if you have that provider that is in front of you, please ask them any question. There's no bad question. I think as long as questions are asked in good faith and you're really just looking for information, everybody wants to make good
Yeah.
decisions for their families. And so, yeah, I think, everybody needs to have a place where they can go, where they can get information, write down their questions, and hopefully have those questions answered by somebody that they trust.
Yeah, and in this age of technology too, if your pediatrician is on an electronic medical record, right, and you have that portal, you can send a message ahead of time, like, "Hey, I'm coming in for my well visit on this day. Heads up, I have these specific questions about my health, my vaccine, whatever." And that's super helpful. Like, I kind of wish it's a little less ideal in the ER, but if before I even walked in a room, sometimes it happens that the family tells the nurse, like, I really want to know this thing. And so then the nurse will tell me, I'm like, oh, okay. Then I know, like, okay, what I'm going in, exactly what we need to focus on, other than whatever their chief complaint may be. So I only got to post about our discussion this morning. And so I invited people if they wanted to, for those watching, you can ask questions now, you can post questions later, and we're happy to answer them. One person did submit a question before, and it had to do, I think this ties back to a lot of the misinformation about vaccines. The question was, if you have G6PD, so G6PD, for those that don't know, is glucose 6 phosphate dehydrogenase deficiency. It's a mouthful. But basically, if you have that deficiency, so if you don't have that enzyme, then your red blood cells are a little more fragile. And so if you take certain medications, sulfa drugs, I'll never forget fava beans. I remember learning that in med school and thinking, like, what's a fava bean? And then years later, I ate fava beans and I was like, oh, like, if I had G6PD, I would not have to worry about the fava beans. But if you eat certain foods, there's a list, you can look that up on a reputable website. Certain foods, certain medications, that if you take those, your red cells can become more fragile and you can become anemic. Those red cells can break and don't work well, and you can become anemic. So that's a problem within your cell. And I think people forget that, and I'm not saying specific to this person that asked the question, but in general, because I've heard this a few times, people forget that vaccines do not change your cells. They change nothing on a cellular DNA level. Nothing. And so the reason people with a G6PD can get these vaccines, I'm saying these vaccines, I don't know, there may be one that has a component in it that it's recommended they not get. I don't know. But at least for flu, it doesn't have anything that's going to break down these red cells, to my knowledge. But again, like, they would have to discuss that with their, usually it's hematology that deals with that. And the other part of their question was, if, I think the question said ANA. I assume that means ANA positive, which can indicate that you may have an autoimmune disorder. But as long as you're discussing that with your immunologist or your rheumatologist or whomever is covering that, my guess is that they would advise you to get it. Might not want you to get a live vaccine, but at least for the inactive vaccines, would advise that you get it. So that's the difference of like, why can't I take certain medications or eat certain foods, but I can get this vaccine. I had somebody ask me the other day, and I kind of had to like stop and really think about it. For a blood transfusion, what's the difference in the blood of someone who's been vaccinated against COVID and someone who hasn't?
There isn't any.
There isn't. Yeah.
There isn't any. And actually, AABB and some of the other like big blood centers actually have this information on their website because it has been a question that has come up. And so they have the science. I will go and find the resources and share those with you so that you can share them with your audience.
Okay.
That question. I think that's a great question, and happy to share out those resources. Interestingly, that has been a legislative trend that we have been seeing around the country and in Louisiana. Last year, we had this bill. It did not get a hearing. I think the author decided that he wasn't going to put it up for a hearing. But again, it's something we could see again potentially. We're seeing it drop right now in other states. Is this bill to label differently the blood of people who have been vaccinated? Some of them even call for a test to like test blood to see if it has been, if the person has been vaccinated. There is no molecular test that can do that because there is no molecular differences. Yeah.
And yeah, I think it's something that people forget too, that the vaccines don't live in your system forever, which is why we require boosters. Some last longer than others, confer immunity longer than others. But it's not changing us on a cellular, like genetic DNA kind of level.
I think so. When we think about vaccines and like how do they work, if you think about a virus coming into your body, your immune system has to react to that virus, but at the same time, that virus is multiplying and spreading throughout your body and causing all of these symptoms to occur, which is your immune system trying to fight it off, right? But then we think of a vaccine. A vaccine is similar. There's a component of the virus, right, typically, that is introduced. And so your body sees that, the immune system, the immune cells see that, they start reacting to it the way they would if it was the virus. But because it is unable to multiply and spread and cause all of these other symptoms, instead you get this very targeted, okay, I see this, I'm going to make a memory to it, is basically what your immune cells are doing, right? And you don't get that big inflammatory response. You might get some, you may get a fever, you may feel a little bad depending on the vaccine and your particular immune system, but then that's it, right? The virus, nothing is replicating. And so your immune system sees it, takes care of it, and then it makes a memory so that if you do encounter that virus one day, or bacteria, depending on, what the vaccine is for, your body's going to recognize it and hopefully be able to fight it off before you even feel the first symptom.
Yeah, I tell people it's like seeing a wanted poster. Like if you see a wanted poster, then you're like, oh, okay, I'll be looking out for that guy. And then or guy, girl, whoever. And then if I'm out at the gas station and I see somebody that looks like that person, then I'm going to call the police. I'm going to act. And so it's your body saying like, oh, that's the one. And now we're going to act. Yeah.
The molecular process that's happening inside your body is very similar. It's just worse if you see the virus, right? Like if you see the active pathogen, it's a lot worse. And so, vaccines are just this incredible technology that we have where you can get that protection without having to actually have the negative effects of the virus or bacteria or other pathogen.
And I think also, if you're maybe people aren't as familiar with the terrible sequelae of the flu. And so one thing that we see not uncommonly in kids, and I talked about it yesterday, is viral myositis. And that has to do, we're not 100% sure why some kids and not other kids, but it does have something to do with the viremic load. And so if you have a tremendous amount of virus circulating, because your immune system can't keep up, right? Because it didn't recognize it to begin with and doesn't have anything ready to go, has to kind of start from scratch, then you're going to have more virus in your system. And then you're more at risk for all of those bad things, not only myositis, which is just muscle inflammation, but myocarditis, inflammation of the heart and lung illness, right? You can get a mild viral pneumonia with the flu, but with a high viremic load, you can really have significant respiratory distress. So all of these things are important too. And so the vaccine is decreasing your overall morbidity, like how sick you get, and mortality rates too.
Yes. I know one thing that, we've heard a lot in terms of the flu vaccine is people worried about Guillain-Barré syndrome. But I think what people don't realize is that the flu virus causes Guillain-Barré syndrome. And so, the risk of getting Guillain-Barré is much, 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 much higher if you get the flu. And so it's best to try to not get the flu and get vaccinated. Yeah. It will actually reduce your chances of getting Guillain-Barré. And it's similar, you mentioned myocarditis, with the risk of myocarditis and COVID. The risk of getting myocarditis if you have COVID is much, much, much higher.
So much higher.
And all of the reports that I've seen, the myocarditis that results from COVID infection is much worse, right? Like, people don't heal from it as quickly. They're hospitalized longer. And so again, to reduce your risk from that, getting vaccinated. And if you're in that group that has that higher risk, is have that conversation with your physician and your child's physician about their particular health situation, and go into that making, the best decision that you can for your family and for your child.
There may be people watching who aren't in Louisiana. Is there, I'm not going to ask you to give us a list of all the states, but is there like a centralized location that people can go to say like, oh, is there an organization like yours in my state?
Absolutely. So please go to safecommunitiescoalition.org. There you will find a list of the states that we are in now, but you can also sign up to be on our email list. We will send you guys communications, and you can always feel free to contact us if you are interested in having a group like us in your state. If you guys are like, oh, I want to lead a group like that in my state, please contact us. We're always happy to talk with people in any state.
Awesome. And I, on your website too, I love the news blurbs, because it was just like, it's like a cheater's way of following everything that's been going on in Louisiana news in the last, going back. So I also found that incredibly helpful.
Awesome. Great. I love that.
And then just to close out, we talked yesterday about these declining vaccine rates and what it means for public health, but also what it means for us as pediatricians and how we are treating some of these things. I mean, we have new illnesses popping back up that I wasn't trained to treat because we did not see them. So we heard about them, and we know, like textbook and boards, I can tell you the answers, but I haven't seen these patients because these were illnesses that were eradicated or mostly eradicated, and just we didn't see it. And now we're starting to see again. And I shared with you yesterday that even on several Facebook groups, you have more junior pediatricians, which, like, I'm almost 50, but I would consider myself in that group, asking our older counterparts, like, hey, when you had a patient presenting with XYZ, what was your typical workup, or what were you? And we're having to go backwards to make sure we're taking care of these patients appropriately, which is a really frightening thing, truth be told. So I know we've touched on some of the other vaccines, but we've really talked about flu. But any guidance for families? There's so much out there that's incorrect, but families who may have a newborn on the way, or thinking about having kids, or maybe have a child that they have opted to not vaccinate, then maybe they're thinking about adding some vaccines.
Yeah. So I'll point you back to Voices for Vaccines as a great resource, and also the Children's Hospital of Philadelphia. If you have any questions about vaccines, you can do a search in their vaccine education center, and almost certainly it will come up with a lot of information. And then, take those questions. Even with that information, you're probably still going to have questions. And so, if you're going to have a child and you're thinking about whether or not you should get that child vaccinated, when you go and you interview pediatricians and you're thinking about who am I going to get to care for my child, ask them these questions, bring this to them. Especially once you find one that you're like, yes, I trust this physician, this is the one I want, bring those questions to that doctor. Talk to your friends who have vaccinated their kids. Ask them why, ask them how their kids have done, and so it is scary, I would say, as vaccine rates are declining, and thinking about new babies, they're so vulnerable. And as a mom of 3 littles, it's something that I have thought about with the birth of each one of my children is, how do I keep them safe? And of course, those concerns only keep going as they get older, and those concerns change. But yeah, I think it's really important. And if you're thinking about that now, it's a great thing. It's very important to make these decisions and to feel good about these decisions. And so if you're thinking about it now, that's great. Please, look for these resources. Again, you mentioned healthychildren.org. That's a great website. Voices for Vaccines and the Children's Hospital of Philadelphia. And then again, that's a lot of information you're going to find. Take your time and find a trusted expert that you can ask questions. And hopefully you're able to access a physician or a nurse or somebody in your medical community that you can have those conversations with and get some good answers.
Yeah, no doubt. Just on a personal note, I took my boys for their checkups this summer, and my 11-year-old, I had prepped him. I was like, look, it's booster time. Like, you had a lot of years without having to have anything except your flu shot and your COVID shot, but it is booster time. And so we mentally prepped, promised some ice cream after, and all of those things. And totally forgot that he's the age for Gardasil, which is like a whole nother hot take that people have a lot of opinions on. But and I think this is another important thing, is to be honest with your kids, and knowing that they one day will be consenting adults, right? Mm-hmm. But they can certainly be assenting patients too, and say, and have some agency in their healthcare choices. And he said, what are these things I'm getting? And we talked through it. Like, these are the vaccines, and this is why you're going to get Gardasil now. And if you have any questions, like, we can talk about it now, or we can talk about it after. And of course, he's like, let's just get it over with, and we'll talk about it later. And it was fine. But my point, and I did a live yesterday about puberty and talking to your kids, and in whatever way is comfortable for you and your family, to address things with your kids. But this is the Gen Alpha is the generation of seeking information, and they
Mhm.
have information at their fingertips. And if it doesn't come from you, it's going to come from somewhere. It's going to come from a friend. It's going to come from the internet. And so it's really important if they're obviously you can't share vaccine information with a baby. I mean, you can. They may not respond to you, but if your kid's old enough, then I think it's really important to share the science, and they're interested and they want to know.
Absolutely. Absolutely. And, if you don't, I mean, we have the background that I think that we can talk about the science all day if we want to. And not everybody does, but, go to those resources that we talked about with your kids. If they have a question, oh, I've got this vaccine coming up and I want to know more about it, go on voicesforvaccines.org and look up that sheet with your kid and look at it and see, do they have questions that they want to ask the doctor, when they go in for that visit. I think that is really great. And I'm really glad you brought up Gardasil, because every time we talk about the HPV vaccine, I always hope that people realize that that is a cancer vaccine, right? That
The one, right? The only is it the
the
only
second.
one?
So the
Yep.
hepatitis B vaccine prevents liver
True.
cancer. So we
True.
have
True. True.
two
True.
vaccines, amazing vaccines that can prevent cancer. Um, and I just like, there's nothing more incredible than that. Hopefully, we keep
Yeah.
getting new vaccines. We've gotten the COVID vaccine, and now we have this RSV vaccine, which,
Which I'm so happy, but dang it, I was like, when my kids were born, I mean, back then there were very strict guidelines. I mean, even preemies, you had to be like less than 34 weeks, I think. I can't remember the exact in the old, I call it the old RSV vaccine. Um but I wanted my kids to have that, and I was like, oh nope, you don't fit the criteria. So the
Mhm.
fact that that's available to pregnant moms, um and to these babies, these at-risk babies, is really incredible.
Yes, yes. I mean, I know like my kids experienced RSV because it is so common. And
It's so bad.
it is just awful. And I remember one of my friends, her baby was actually hospitalized from RSV, and I had just had a baby, and so we were very excited about getting our babies together. And then her baby got a fever, and we were like, well, maybe we'll wait, And it was around Christmas time, and and then he ended up in the hospital, and it was definitely not the Christmas that they wanted. Thankfully, he is fully recovered and he is a thriving little boy now.
Yeah.
It's so scary, and parents have the opportunity to, you know, have their kids not ever need to experience that, which is just completely amazing. And it's also for older adults, which
Yeah.
I'm feeling so grateful that my parents were able to get that, because it actually impacts older adults a lot. We lose a lot of our older adults from RSV. I think, more than I even realized before I looked into it, what an impact that virus had on older adults. And so now we can protect them with this vaccine. So it's extremely exciting.
Yeah, it's been really interesting to talk to families who have like maybe a 5 or 6 year old and then have a newborn, um, and hear well, when my older child um, was an infant, had RSV and was hospitalized. And so now, like, I immediately made sure that we were protected with this. And it's really like, it's like a warm blanket. Like, I feel really good for them.
Yeah, yeah, it is. It's amazing just knowing that we can protect those babies.
Yeah. Well, Jen, thank you so much for joining me and for answering all of my questions, and for starting this amazing nonprofit. Like, just a friend commented, I don't think you saw, because of the Facebook. That's a whole nother topic, right? We won't even get to that and fact checking. But Jamie Quo said, commented like, I love Jen, she's so amazing.
Thank you.
So you have lots of fans, and we definitely appreciate all of the hard work you're doing, and we're happy to support your organization.
Thank you so much, Ashley. It was a pleasure to be on with you today.
Thank you so much for joining us. All right, everyone. If y'all have any other, if you have any questions, just drop them in the comments, and we'll try to get to them as soon as possible. All right. Thanks. Bye, Jen.
Bye.